confirmed case, and Dr Young will talk a little more about that shortly. That means we have 18 active cases. Our total confirmed cases is 1,106, and there were over 6,300 tests in the last 24 hours. Can I thank everyone for coming out and getting tested? But of course, it's very critical over the next 7 to 14 days. If you have any symptoms whatsoever, please go and get tested. It is absolutely critical that everyone follows these messages. I can confirm that all of the young people at the detention centre have now been tested. We are awaiting just a few results there. And all of the Brisbane Youth Detention Centre staff have been tested except for 16, and we are working on those people as a matter of priority. Of course, all schools are open today, which is great news. And yesterday, some people may have received emergency alerts. We are letting people know in those particular suburbs where some of our confirmed cases have visited that if you develop any symptoms, to go and get tested. So I think we're getting all of the direct messaging out as quickly as possible. And there are a lot of fever clinics that are set up across the southeast. So if you are feeling sick at all, please go and get tested. So I'll hand over to Dr Young, and then we're happy to take some questions after we go through everyone else.
So one new case overnight who is the relative of one of the workers at the centre. So that's a close contact, and she was placed into quarantine on the 22nd. So we'll now work with her to just sort out her infectious period, and whether that means we need to let people know of any other places that potentially are a risk. So it's very important, though. You would have seen all the list of the many places across Greater Brisbane and Westmoreton and Logan that people who have been infectious have visited. There are so many places that really it's about, if you've got any symptoms at all, come forward and get tested. This is the time to do it. Thank you very much to all of those people who did come forward in the last 48 hours. That has been excellent, but we do need more people with symptoms to come forward. We need to track this virus down where it's been. It's an infectious virus, as we all know, and we need to act quickly, promptly to be able to contain it. Now, I have put in place some new arrangements with our hospitals. So I have asked our hospitals, and we're going out this morning to primary care, to recommend that they consider using masks within their facilities for all patients, visitors and staff. That we just need to manage this as we go forward. So for that area of Greater Brisbane, so Metro North, Metro South and Westmoreton, those three hospital and health services, that this is the time to implement mask usage broadly within the facilities. We can do that because of the enormous work that's been done since the start of this pandemic to put in place local manufacturing of masks, so we have enough masks to do this. And so as a precaution, not because I think that there's been any great escalation, just as a precaution that I want this in place throughout our facilities. And there were some other things that people need to continue to adhere to. We've seen with this cluster, we now have 5 workers at the centre and 5 of their relatives have already been infected. We know that spread within households is what you always will see at the start of a new cluster, which is why we put in place that requirement to limit gatherings to 10. It is really important that within households, within private gatherings, maximum of 10 people, because it's that closeness that we know will lead to spread of the virus. That's extremely important. Outside this immediate area of concern of Brisbane and Ipswich, gatherings have been limited to 30. Now, for the rest of our society, as long as people follow those COVID-safe plans, I've been through all of them, I know how good and solid they are, then I think they are fine. If people don't follow the COVID-safe plans, that's when we'll have to consider what else might need to be done. But at this point in time, I'm very confident that with those plans rolled out, they've all been in place for quite a while now, so people know what they're doing, that we don't need any further restrictions. So it's just those gatherings of 10 people, that's really important, and adhering to COVID-safe plans. So everyone, please, throughout the state, any symptoms, come forward, get tested and isolate yourself. That's really important. And maintain social distancing wherever you can. Thank you.
Is it time for possibly a wider community to start wearing masks quite apart from the hospital?
I think that this is the time, because we know we've got the masks out there, that everyone should consider, if they can't maintain social distancing, that it's time to use a mask. So if you're in a crowded situation that you can't get out of, put a mask on. So I think, as I've been suggesting for some time, a bit of hand sanitizer in your back pocket or your handbag, and a mask with it. And if you get yourself into a situation where you cannot socially distance, it's time to consider using a mask. I'm not going to mandate it, because I don't believe we have broad spread community transmission, but certainly we're in a risky period at this time. So within Greater Brisbane and Ipswich, within those areas, it's time to think about, if you cannot maintain social distancing, wear a mask. Always remember, social distancing, that 1.5 metres, is far more effective than a mask. Masks are not totally foolproof. They will not protect you totally. Whereas maintaining social distancing and washing your hands will protect the vast majority of people in the vast majority of situations.
Will you be closer to working out how the original work of 77-year-olds and traffic?
No, but I hope to get that answer fairly soon. So we're waiting on the genomic sequencing of these cases and those cases that came from Melbourne. That's what I'm working on at the moment. Yeah, it's too early to say.
Numbers. When the first cluster was identified a couple of weeks ago, we saw numbers around the 20,000. This is significantly less. Is that a concern? What's your thoughts on that?
It is a concern, but also I suspect people are starting to hear the message. I want to test people with symptoms. So I know you can have this disease without symptoms, but those people are very, very rarely a cause of a chain of transmission. It's the people with symptoms that are the really critical group. And I think we're seeing more of the people coming forward actually are those people with symptoms, and they're the really critical group. So I think that people are starting to understand the messages, because they are very complex messages. They are really difficult messages. So I think it's just, we're 7 months in now and people are hearing that, and people heard the first time and now they're hearing this message. I also suspect the weather might have had something to do with it. It was a really bad weekend for Brisbane. It was very, very windy, it was cold, and I suspect a lot of people were at home. So today and the days coming forward, really, I do want people to come out and get tested if they've got any symptoms at all. That's really important. Yes, I've essentially declared all of Brisbane and Ipswich a hotspot, a restricted area, whatever terminology you want to make, but it's Metro North, Metro South and Westmore Hospital and Health Services. So that's all of those local government areas that sit in there. So it's Greater Brisbane, out to Redlands, including Logan, going out to Ipswich. Well, it's not a declared hotspot, it's a restricted area. It's an area where I've put restrictions in place in terms of hospitals, in terms of gatherings, and in terms of getting people to be more alert and come forward and get tested. There's no restrictions in travel at this point in time, but of course the normal requirements remain. If people are sick, this is not the time to go travelling. So before anyone goes and leaves their home to move out of this area or to go anywhere, they should think, am I well? And if I'm not 100% well, that is not the time to be travelling.
Our friends in Townsville wanted to get an update on the cargo carrier. There was a couple of cases on there. Is the testing done now? Are the cases recovered?
So those cases are in hospitals across the state. So we've got those 5 cases out there. Yes, 5 cases. And the other cases are all in quarantine on those cargo ships, and they'll all get tested again prior to exiting from quarantine.
Was it a case of a 2-year-old girl who had open heart surgery who
Yes.
wasn't allowed in or was now granted an exemption last night? Why was that granted?
So she was always, of course, allowed back into Queensland. She's a Queensland citizen, as are her parents, so she was always allowed back in. Her initial request didn't convince me that her parents understood the necessity for quarantine. She must be quarantined with her family. So I've now, because they now fully understand that necessity and my concerns, so they've agreed to go into their home and to quarantine, and we've got a lot of support in place to ensure that happens. Yes, we do have serology tests back, but the problem with serology is it's not definitive. It's not like the PCR tests that we know are due to this virus. Serology can react to other coronaviruses, so we just need to wait and see the subsequent test to know what that means. So, yes, there have been some indications, yes. Several. But as I said, there's a lot of coronavirus out there. There are 4 other coronaviruses circulating in our community. Most of them just lead to a very minor cold. So we just need to work out what this means. It's too early to be definitive about any of those serology tests.
So there are, just to be clear, that there are young detainees there who could have had it, but you can't be certain at this point.
That's correct. That's correct.
How much worse could this cluster get, given the numbers involved?
Well, it's hard to know. It really depends on people's social distancing that they've had in place. Queenslanders have been pretty good till now. We saw in the last cluster from those 3 young women who went to Melbourne that we only ended up with a total of 5 in that cluster. So this time it's too early to say, but the risk is definitely there. So it's really, really important that people maintain that social distancing. So we have had these people who've tested positive out in the community, out and about. You've all seen those long, long lists of places they've been. So the risk is definitely there that we'll get another phase of cases. So we've had our first phase, which the immediate contacts, the 5 workers in the youth centre. Then we've got the next phase, which is their relatives and close contacts. So we've had 5 there. So we now have to be alert to the next phase, which is why anyone who's out there needs to come forward and get tested straight away.
This morning that a relative of one of the women who went down to Melbourne and came back, one of their relatives had been in the youth detention centre. Is that something that you're aware of?
That's all of the work that we're working through at the moment in terms of all of the contact tracing. And I actually think when I get the genomic sequencing, that's probably going to give me more of the answers than that other work. But the other work, of course, is happening, is critical.
In the last few days, you've spoken about the young people who have left the detention centre. How many are there? Where are they being across the state? How many have been tested? And how many are outstanding, I guess? How many haven't you been
That might be for Bob. We'll get to Bob in a moment.
Right.
Okay.
I've got that answer.
Okay.
I apologise. Because can I say that our police service in this state are absolutely brilliant. This is one of the real strengths of Queensland, and I can say that other states don't have this same support because they have different systems. So good supports in other states, but we are just so fortunate. So the police in this state have found the families of the 92 youths who have been released from the detention centre from the time that I've been concerned about. So those 92, they know where they are. They've actually contacted and physically laid eyes on 78 of those youth already, and they've spoken to their guardians, parents, families for the others, and already we've tested 42 of those. So we're well on track to get hold of all of them. Now, can I just say to you, the 92 are me being super cautious. These are people who've been discharged from the centre from the 22nd of July, which you might remember is the date that those 3 young women came back into Queensland and were in Queensland. So I've really been very cautious here. I think that most of those are not a risk, but I just wanted to absolutely check on those. Yes, I've been granting exemptions to farmers right from day one. Agriculture is really important, not only to our state, but to the rest of the country. We really are the food bowl for our nation, so that is just critical. And farmers have done so well in terms of managing all of those COVID-safe plans. They've done a really good job. So yes, I have granted a lot of exemptions. There's blanket ones and there are individual ones. Yeah, just because some of the farmers don't quite neatly fit into a general exemption that I've made, so then I've been giving them specific ones. So my advice to the farmers out there, that if you don't fall under one of the general exemptions, to come forward and ask for a specific one. We need our farming to continue. We also need our construction to continue, and we need our resources sector to continue. And their COVID-safe plans have all been absolutely first class. I do, but not in my brain, I'm sorry. Yes, it is. It is a lot.
Is there any concern about the capacity at the Ipswich Hospital? We've been contacted by people who work there that say it's reaching bed capacity because aged care homes in the region aren't accepting patients at the moment. Can you talk to us about that?
So all of our hospitals are reaching capacity, but they do that every winter. So they actually have got a lot of spare capacity because they don't have the cases of flu they'd normally be expecting. So they're all fine. They're managing it. That's what they do every single day. They do it very well. So I don't think anyone should be concerned that they won't get care at one of our hospitals.
Can I just get the Deputy Premier first and then the Deputy Commissioner? Thanks.
Thanks, Premier. Look, clearly the fact that we are confirming just one case today and they were already in quarantine is a relief, but there is a long way to go in managing this cluster. I particularly have a message to people in the Greater Brisbane and Ipswich areas. We need to test more people. 6,834 tests in the last testing period is not enough for us to be assured that we are finding all of the cases that are out there. And I especially want to say to the people who might have already been tested earlier in the pandemic, we know a lot of people, particularly in Logan and the southern suburbs of Brisbane and Ipswich, got tested in the last cluster, and they might think they don't need to do it again. But if they have any symptom at all, I'd really urge them to come forward. Please do get tested again for your own sake, but also to help us assure ourselves that we are finding every case associated with this cluster.
Lane, we have a number of investigations underway. There's been people given notice to appear since we started. There's been 19 of those issued. Happily, there were no new PINs issued in the last 24 hours, and certainly no notices to appear. While I'm not aware of what that is specifically, I would imagine it relates to one of the earlier matters. So could I just start with some stats and then come back to Patrick maybe then? So in the last 24 hours, we've met 37 flights. We have checked 1,372 passengers and refused entry to 3. At our road borders, 2,407 vehicles were intercepted. We refused entry to 156 persons. And on our quarantining from those borders, we've put 75 into quarantine, which brings the total number of persons in hotel quarantine in Queensland to 3,084. Over the weekend, we checked 512 licensed premises across the state. Did not take any formal action in relation to any of those. But could I pause on that to say that we are concerned by some of the behaviour in our safe night precincts, and particularly when people are out and about late. We've seen too many instances of people affected by alcohol, misbehaving, assaulting police, assaulting security guards. And whilst this sort of thing may well happen in normal times in our community, what's really clear that this exacerbates the risk to our community at the moment. So no doubt some have seen the vision of a particular incident on the weekend, which is under investigation by Task Force Sierra Leone. That is extremely disappointing, that kind of behaviour. So the message to all of those persons, and a lot of them are young people, I have to say, so sorry young people, is to have a think before you go out and think about the impacts of your not abiding by the social distancing in a community and what that means. So it's certainly putting our police under pressure in terms of trying to monitor those areas, because the licensed premises by and large are doing the right thing. It's the people that are attending that still aren't quite getting the message that we'd like to see. The Premier, I think, mentioned the emergency alerts. We will monitor that today to see what impact that has on the people attending the testing centres. There were 13 suburbs and 107,000 phones that were impacted by those. That was very targeted yesterday for those areas where we have had people with COVID into, so we will monitor that and see whether we need to do more in that space. All our planning around continuity for the Brisbane Youth Detention Centre is really well underway. The quarantining of the workforce there, and I'll leave that to Director General G if he wants to comment more. We're very pleased with the progress in locating the young persons that have been released. So excellent work done by our investigators across the state to track those young people down. As I mentioned, there have been no infringement notices in the last 24 hours. However, we have 4 current investigations in our Task Force Sierra Leone and 6 matters being overviewed that have been conducted across our region. So there are still people that are choosing to do the wrong thing. Most of that relates to border breaches. And since we've introduced the false declaration, there's been something over about 75 infringements issued for people lying on their border passes. So that's still happening, which is very disappointing. I'm going to leave it at that. If there's any questions around protest activity and the like, the Commissioner's here today, so she can deal with the policing matters. Thank you.
Last time we featured footage of a kebab shop, everyone dancing in the kebab shop, and there was also some footage of some underground parties, Portuguese club at Pinkenba. Are you investigating that? Yeah, that's certainly the one I alluded to. We're aware of that vision. We have that. That's been coordinated through Task Force Sierra Leone, which is under my command, as part of the COVID response. So we're taking that very seriously. And we're not just focusing on the people that are in the vision, we're also focusing on the businesses that were operating in that area. The kebab shop and the underground. All that will be completely investigated.
Those emergency alerts, they're text messages, are they? They're emergency.
Yeah, it's a text message that will come to a phone. The way it works is that we're able to identify geographic areas. It's based around cell towers, basically, and people will get a message. And the focus for this is very much, if you've got symptoms, go and get tested. Look, I don't have that information. I can't comment on that. As Dr. Young said, our contact tracing that we assist health with, they lead that, is very, very detailed, and we run it all out. And obviously, as there are more cases or more people are identified, there's more work to have to be done. Yeah, look, absolutely. And the interventions over the weekend have largely been educative. So we've seen instances of people in parks and people not being aware. And because we have got compliance, when we have spoken to people, they have taken the advice of police and they have moved on. And I have to say that that's the disappointing thing about the liquor precincts as well, is that when our police do intervene, people do take notice and they do comply, but do it up front. You know, that's what we're trying to say. Don't wait to be told by the police. When will the fines begin? The fines will begin when people blatantly ignore the Chief Health Officer's directions. That could happen any time. Thank you.
Earlier on in the pandemic, the police got a new online reporting system for domestic violence.
Yes.
What's the response been like?
Those numbers have increased. I don't have the exact numbers, but certainly has been extraordinarily successful. We were the only state that did that in the country at the time, and we have certainly found that people are using the online reporting and still are. So I can get you those numbers.
And are you still concerned about the levels of domestic violence in the community during the pandemic, given the restrictions have started to ease? Was this an increase?
Yeah, I think we haven't seen the true numbers yet, so I think as we begin to open up a little bit more, we may see an increase. There's some anecdotal evidence that that is the case. Certainly from our support agencies, they're seeing an increase, and we've had some numbers on that online reporting. But what we have found definitely is the amount of breaches are up dramatically, and we're just getting across now whether the applications are as well. So I think we have yet to see that evolve, but certainly it is concerning for us as always.
Commissioner, are you planning a big restructure of the police service? There was a suggestion I saw on TV over the weekend.
Yeah, interestingly, I did that review about a year ago, and all along the review showed us that because of demand in the community and our response obviously to demand, there needs to be a realignment of the organisation, and we need to put our resources where they need to be. So simply basically addressing the demand issue to make sure our organisation is as effective and as efficient as we need to do, and it's best practice. We should be doing that constantly.
Freddie, can we know you on some politics?
Yeah, sure. I wouldn't expect anything less, Patrick. Sorry? Oh, Patrick's back.
Your former colleague, Christine Smith, says she's disgusted about the whole Burleigh candidate process. Your response?
Oh, look, Christine served the people of Burleigh for many years. I need a very strong candidate down there, and Wayne Rabbit Bartholomew will do an excellent job, and I hope that he'll be part of our team in the future.
Isn't this the sort of thing you were throwing, attacks at the LNP with the Currumbin sort of parachute?
I need the best people in these jobs to make sure that we're focused on our health response and our economic response. And I believe that that Wayne Rabbit Bartholomew is absolutely the person to be on my team.
What about other seats? There's suggestions you may be going to axe the Harvey Bay candidate. Can you guarantee his spot?
Whose spot?
Adrian Tantari, the Harvey Bay candidate.
Well, he hasn't been selected.
Hasn't he?
No.
Premier, this week, I know you're other things to do
Yes.
with, but this week the AFL is going to make a decision on where to hold the grand final.
Yep. So we'll be waiting to hear what they have to say, and I think that's really important because we know how much this means to Victorians, and Victorian families are going through a lot at the moment. So I am going to do the right thing here and wait to see what the AFL has to say.
And putting submissions to them, or we heard last week that Dr. Young has signed off on capacity if we needed to hold it here.
Yeah, and of course other states will be putting their hands up, and I would hope that if a decision is made, then it would be nice to see if Victorians would also get behind Queensland.
Can you give us a little bit of a flavour of your pitch that you'll be giving?
When that happens, I'll let you know, Lydia. Okay, good. All right, thank you. Thanks.